just to kind of go back before we get started, just, tell us something about who you are, how you came into this sort of work, and how autism became part of your life.
Well, autism became part of my life when I was doing my education as an early child educator. I always wanted to be an educator. When my niece was diagnosed with autism and epilepsy. And so it was sort of in my wheelhouse, I understood very little about it though. That was over 30 years ago. And then I had a son in 2003. I was teaching, but when he got diagnosed, I knew that he wasn't hitting ages and stages just because of my background and knowledge and whatever. And so I took him to the pediatrician, and back then they didn't really want to diagnose kids with problems. So we went through the whole rigmarole. We did the ear testing, we did the hearing, we did the, eyes. And so then he was originally diagnosed with what they called globalized developmental delay. And so I was like, all right, what does that exactly mean? And my pediatrician was great. I had a great pediatrician who also then referred us to a pediatric psychiatrist. So I had a nice team around me, but we still didn't know what was going on. He went to kindergarten, got his ears fixed, went to kindergarten, was doing great, but then he plateaued. And so I was like, okay, he's still not able to mark, he's still not able to hold a pen properly, he's still not able to, and then I also saw a bunch of his skills that he had seem to go away. So things that he was able to do at age 2, all of a sudden at age 3 and 4, he couldn't do. And, but I had been prepped already, so I kind of knew that autism, there was a possibility that they were looking at autism for a diagnosis. And so, you know what, that way I said, as much as Dr. Rajnika just handed me a bunch of papers at the end and said, I was like, so what's the final outcome? And she was like, oh yeah, he definitely has Asperger's at that point, because now it was under DSM-IV. So, and then now he's been rolled into as DSM-V5 under autism. But I remember thinking, thankfully I had the psychiatrist and the pediatrician who I'm like, what does this mean? Right? And to me, I remember I was crying and I called my cousin because she had a niece, and she started saying sorry, and I thought, okay, I should be devastated. And then I talked to a friend on Facebook, and I think for parents it's the most wise information that I got, which was, your son is still the same. He's the same kid that you knew for the last 4 years. He hasn't changed. However you dealt with him for the last 4 years without this diagnosis is how I need to deal with him moving forward. He's the same kid with the same needs, and that naturally as a parent, I already accommodated it. And so that I needed to continue to, now it just had a name, right? It's kind of like when you have a baby, you don't know what you're gonna name it till it actually comes out. So now it just has a name. It doesn't change who the kid is. It doesn't change what you know. And I'm so thankful for that advice, because moving forward, when I had all these specialists, I remember doing the whole rigmarole with having an OT and a psychiatrist and a psychologist and a SLP and a teacher and all of these professionals in my life telling me that my son needed this. And then, I'd get SLP who'd come once a week, and then, I'd have all this homework for the next 2 weeks. And then I had a homework from and it was like, you know what? Most important was to slow down. And for me, these are the moments that I missed, that I would advise any other parent, because about 5 years ago, it was my BCBA and team at that point that said, Mom, you need to stop being his therapist. And I realized that I'd gotten so caught up in all these specialists that I forgot my most important role, which was to be his parent. I needed to be his safe space. I needed to be the place where he could have his meltdowns, the place where we could break rules, because my son's life is all about rules. He needed to be the place where I can have fun, the place that he can go to and not say a word, right? That I understand the days that he needs a good, strong hug and the times that he doesn't, right? When he just doesn't want to be touched and left alone, and times when he's, even at 18, when he just wants to sit next to me and do his own thing. just to know that I'm there. And that was the biggest gift, and that's what I would tell parents is these experts are great and they're awesome, but remember that they don't know your child. You know your child. You live with your child 24/7.
What is it that you think about, because you've said the team around you was really wonderful. What was it about them that made it wonderful? Like, why was your experience at the time a positive one with the medical expert?
I think it was positive because I had a pediatrician who took the time and didn't just label my kid, okay, this is it, he's got a diagnosis, but the diagnosis was only part of it, right? They were like, when I had all these questions, they were okay with answering them, right? I remember sitting down with Dr. Kimmins. I think he made an hour appointment where I just sat there and just asked him a bunch of questions, right? So they didn't just say, okay, here's a diagnosis and my job ends here. They actually took the time to not just hand me pieces of paper, but actually look at me as a human being, reassure me as a parent, and say, you know what, yeah, this is it. And yeah, we have all these therapies and we have all this stuff going on, but there's things that are good. There are things that are, and they would point out that, he's still healthy, he's still able to do this, he's still able to do that. And so they helped me to focus back on his strengths, right? It didn't, because when you hear that diagnosis, you think, oh my God, there's all these deficits. And you know what? It's not all deficits. There's things that he's really good at. My son is an amazing kid. Yeah, he's not good at certain things, but that's okay. And I mean, you asked me what is one of the things I do now. So a few years ago, that's what I realized is that, you know what? I'm not the only parent that's gone through this nightmare of trying to figure things out. So I kind of started my own little company. It started out with just me and a couple of my friends. And it's grown, and my real goal is I really just want to be available to parents and give them a parent perspective. Because education, yeah, I have the education, but that only is a small piece. I live, and I always say that, I said, when you're living autism 24/7, it's different. And sometimes you just need to be around people who get it. That you don't need to explain yourself, you don't need to do any, and I think that's where it's so important to get involved. Like just recently over the last few months found SAAAC, which was so important. And 18 years, yes, I've in the community, yes, I've had family, yes, I've had but the support that I found from the SAAAC members, from the SAAAC parents, I have not had that level of support and acceptance for 18 years. And I'm very grateful, and I encourage everyone, because they get me. They get when I say, you know what, my son doesn't want to dress up and go to this wedding, or he's having a bad day, sorry guys, I just can't be here for this. Or, all of there's no explanation needed. There's no, what do you mean he's not going to do this, or he doesn't want to eat the laddus, or he doesn't want to, especially in our South Asian community, there's so much. And it's so freeing for me to not, for the first time, either have to force my child to do something or to explain to somebody why he cannot. It's been awesome to just have these families who say, I get it, don't worry about it, it's okay, how can I help? And that's huge. That is, I think we undervalue that. And get connected.
When we undervalue it, do you mean in sort of when we're looking at the diagnostic process? Do you think that culture piece is missing?
It is, definitely, because how it affects, for me, I speak as a South Asian Punjabi woman, right? There were certain roles, and so it was great my son was diagnosed, and then, immediately my family wanted to pretend that the diagnosis didn't exist. We also had, as I mentioned, my niece who was at the other end of the spectrum. So then half the family, well, how can he be autistic and she be autistic, right? The whole idea of explaining that it's a spectrum, right? These kids, they have some things in common, but he's not her. That still doesn't mean, and so then, the whole thing is he's just gonna be fine. Let's just pretend this away. Those are the things that, as a South Asian, it was hard. And then as a woman, you're trained to just give and give and give. And South Asian women in our culture, we put ourselves last. And so there was no sitting there and saying, okay, and that was my job, was to fix it, right? I had to fix it. I had to make it okay so I had to dress up my son and bring him and I would drag him around crying, saying hello to all the elders and whatever. And it was exhausting for me. It was exhausting for him because I had to pre-plan it, but everything had to be pre-planned and hidden. I couldn't just come right out because he wasn't considered super severe, and it wasn't something that they could, it wasn't like he needed a wheelchair or he was on a bunch of medications and so everybody determined. So now, because if he wasn't doing what everybody else was doing, so now I had to do all of this stuff, but I couldn't do it openly, right? It had to be very hidden, and so that's a lot of stress. And I've heard from a lot of families, there's a lot of stress even where the partner is not supportive. I'm a single mom, so I didn't have that. But yeah, I mean, I love my family and they support, but even to this day, my dad doesn't understand. I mean, they're there, they love Patrick to death, and my dad would do anything, but he doesn't, it's hard for them to understand how certain things hit them because these kids are very literal. So my dad says, oh, it's okay, you got to be the man of the family. My son walked around and thought it's his responsibility to take care of me at 7 years old. Those are things that, we say commonly in the South Asian community that we don't realize, and sometimes that's why I said you need a safe place to be able to just say, okay, you know what? I'm not the only one that's upset about this. I'm not the only one experiencing these challenges, and it's how do you navigate that cultural piece? Because it's great that I got the diagnosis, but there's certain things that were important, and there's certain things that are important to me as a South Asian. It was important for him to, it wasn't about calling everybody auntie and uncle. It was about masi and, and things like that, and teaching respect. Like my son doesn't call people, to this day at 18, he's not allowed to call people by their first name. If they're adults, he needs to show some respect. Those are things that were important for me to teach my son, that the BCBA and from all of these big organizations didn't deem it important enough. And so I think that was really, even I come across, we eat different foods, right? And so they didn't know how to help me go through that. They were like, oh, just take the spices out, or just take this out, or just, they're talking chicken nuggets and pizza and whatever. Well, no, my son wants roti and rice and paronta and matar wale chawal, and that's his wheelhouse. And so I needed to prepare separate foods just for my son than what we were eating at home. That didn't make sense to me, right? And so I think that there is a big cultural piece around everything, whether it's around clothing, it's around family interactions, and I think that's important, right? Because when you're teaching a kid with autism, a mom is a mom and a dad is a dad and an uncle is but that's not true in the South Asian community. Mom, could be ammi, could be, and there's a whole bunch of names. There's uncles are like nana, fufa, taya, whatever. These are important, and I think it's important to teach those kids those things. And then the other part is language. Because yes, it is a communication disability, but these kids are also struggling with 2 languages at times, and sometimes even more than that. And so I think it's important when you're finding someone who's going to work with your child, you should at least have somebody on the team that can understand that language, because it will make it a lot easier. Or it should be somebody that at least has the knowledge to say, okay, so if the kid is saying this word, and I was actually just talking to one of the other parents. I had an experience earlier, just this week, where the kid was saying adas. And I was trying to explain to his therapist, because the therapist had assumed that it was somebody that this child was asking for. And so she mentioned it to me, and I said, no, actually it's a feeling. And she's like, what do you mean? And it was just trying to explain to her, because there really is no English equivalent to this word. But it was, that's the type of thing that parents need to look for when they're looking for family, is somebody who's at least sensitive to that cultural piece, that can understand, because otherwise we would have spent that whole time on a team who's not interactive and not speaking, we would have just dismissed it. And here's the kid trying to express how he's feeling in a language he understands, right? And I'm not saying that everybody has to learn the language, but it was the fact that we have a team that was open and, you know, even open enough to ask the parent, hey, what is this? Right? And so that's where it's so important that as a parent, we're part of it. 100%, like it has to be. It's not like this is autism, dealing with autism. The biggest thing I've learned that's different from anything else is it has to be a team effort. You cannot have any sort, whether it's a specialist, whether it's, you know, you at home and your family, you can't work in isolation. It has to be done as a team because as a parent, you're the expert on your kid. And if you're not involved in the process and it's simply the BCBA and the IT and the OT and the SLP and all the other letters telling you do this, you're not gonna have as successful an outcome as you would be if it's a team. You gotta make sure that your team is listening to you, right? If you're saying, listen, my kid doesn't like, example, some of our autistic kids love to be held. They want to be held really tightly, and some of them, you touch them and they will freak out. So you need to have a team that's open, that's listening to you, because guess what? You're there. When they go home after their 2 or 3 hours of therapy, you're still going to be with your kid. And so you need them to be listening to you. You need them to be adapting programs for you, because you are your child's best advocate. You know your kid the best. So when you hear somebody telling you, well, I'm gonna do this with your kid and I'm gonna do that with your kid, you know what? Take your gut feeling. As a parent, you are the expert for your kid. You are their voice. And it's important for you to be able to tell your team, make sure that everything is clear cut too. Your team shouldn't be afraid to type videos. It shouldn't be a secret what they do. That's the other part, is like never, it shouldn't, like therapy, I understand the reason to have it behind closed doors, but anybody who's resisting putting a camera in there or taking videos for you as a family, those are really important, because the other part of communication is everybody needs to be doing things the same. You can't have the school doing one thing, the therapist doing another thing, and then you at home are doing a third thing. It doesn't work, because these kids thrive on consistency. That's how they're going to learn. And so it's really important as a parent, you have to step in and say, you know what? Yeah, I don't think this is, and don't overschedule your kid. Like, don't, like, love your kid, be with your kid, spend time. Like those are the things that if I had to go back and do it over, I would do over. I would spend less time being his therapist and more time being his mom.
So I just want to go back sort of to that diagnostic journey that you went on, and you know, you connected with specialists and things, you know, that you felt were on your side. When you think about that journey though, and navigating it, you know, as someone who may not have the background, the education, the knowledge base, like some of your families that come to you, what are some things that in that journey you think could be improved, could be made better, so that families have an easier time navigating the diagnostic journey, especially in South Asian communities?
And one of the biggest things is get a notebook and write questions as they come up, because you know what? You're not gonna remember them. It was a tip that actually the psychiatrist gave me. He said, just carry a little notebook. And ask questions wherever you are. Nowadays we have our phones, so you don't even need a notebook. Just open a note, and every time, you know, whether you're sitting at work or whatever, type out the questions. And don't be afraid to ask them, right? Even if it's a message like, as South Asians, we are afraid to ask questions. We think that, well, the school said this, the doctor said this, but especially when you need to ask questions. You need to say why. Why are you doing this? What is the purpose of this? You know, I had a kid the kid is wearing pecs around her neck at school. So I asked the parent, I said, what's the purpose of that? She's like, I don't know, the teacher said she needs it. And I'm like, but the kid is verbal. And so there was just because the school didn't know what else to do, so they created a pack of pecs and put it around the kid's neck. Nobody knew how to use it. this is just what is done, and they assume this is what autistic kids need. But you gotta remember, your kid is an individual. Just because it works for another kid doesn't mean it's gonna work for you. And that's why as a parent, you're the most, especially in a cell, you know what your family dynamics are. You know what your kid likes and what they don't like. You know what your kid's triggers are. You may not know the terminologies, but you know, because you know your kid. And you know, as especially, I say this to moms, no disrespect to dads, but you know, I know when my kid's having a bad day just by looking at him. He doesn't need to say a word. He doesn't need to be crying. I just know there's something that's upsetting him or something that's wrong. And you know what? As parents, that's what we need to know, especially in the South End. And we need to be okay with telling our family no. And I know that's the hardest piece, right? Is like, I still struggle with it to tell my parents, listen, my son can't do this. But if you don't do it, who else is going to do it for them? Right? Who else is going to don't shove food in my kid's mouth? Who else is going to do it? And I always say it would be like, okay, if you had a kid in a wheelchair, you wouldn't allow your family to force your kid to walk. So remember that, you know, it is a diagnosis. It is a valid diagnosis, right? And all these therapies, nobody's going to fix your kid. All they're going to do is help them to interact with the world in a way that makes sense to them, right? And so the role is to bring out the best in your child. And you already do that naturally. I tell families all the time, they're like, whether your child gets diagnosed at 2 or at 4 or at 6 or at 14, you got to remember, for that 14 years or that whatever diagnosis it was, you were still teaching your child, because you didn't know they had autism. So it didn't just change when you got diagnosed, right? It was, your kid was still learning. You were still teaching it. You were like, your kid, unless they're still sitting in diapers, drinking milk out of a bottle when they got diagnosed, chances are you taught your kid something without knowing that they were autistic, without using ABA, without using any of these techniques or all these specialists. You were able to get your child to learn something. And so know that you're still your child's best teacher.
And is that how Convergency started for you?
It is. It was because I felt that too many people were out there and they're like, I have these letters after my name and I'm going to charge these families this much money. And parents are desperate, especially in the South Asian community, we're desperate to help our children. And we will do anything. We will move mountains. And you know, for those of us that have money, we'll throw money, as much money as we can at it, because we want the best for our children, right? And so we will sacrifice to do that. I did that as a single mom, and I see that all the time. And the thing is, so it was almost like I gave him to the doctor, I gave him to the BCBA to fix him somehow. And then I realized, you know what, I'm missing out on those moments because he's with other people. And you know what, like, let me tell you, the first day my kids truly smiled at age 5, I will never forget that day. I'll never forget the day he looked at me and realized I was his mom and called me mom. Yeah, he may not have done it at 6 months or at a year or whatever the normal timeline is, but when he did it, it was extra special, right? And so we have to take those moments as parents and remember them. And so that's why I started this, because it's about bringing out the best. Like, you know, we hear ABA is bad. ABA in itself is not bad. It's how you implement it, right? And if you're not implementing it, using the whole story, like, they're still kids. They're still young. They like the things that most kids like. They want to play. They want to have fun. They want to be part of everything. So all that should be structured around that. It should be fun. Sitting a 2-year-old at a table for 5 hours doing cards, I mean, it works. It's not that your kid will not learn, but you know what? Is there a better way to make them learn? I think so. And I think that's where my background as an ECE, where we say we teach through play, right? I think has become so important. And I've seen this. I've seen it repeatedly. And I don't know why the community is not more open to this type of learning. Like, it doesn't need to be One, and it doesn't need to be every kid needs to be in a center. I personally believe home-based therapy is the best way to go. It was not available as much when my son was growing up. It is more available now. And I think it's important because your kid is going to learn best in an environment that they feel safe in. They feel safe at home. That's their place. Let the stranger come to their home where they're in charge, where it's their toys, it's their parents, it's their stuff. Because it's great to take them to a center. I myself have a center, but we use it for socialization, right? For them to practice their social skills. But when it comes to real therapy, they got to learn what is it like when dad walks in the door, or older brother or sister or little brother or sister screaming and yelling, and they're playing with toys, and they need to learn around those distractions because they're not spending their day locked up in a room. They're coming home to where it's a natural environment. And so you know what? We spend so much time trying to generalize skills. Why not teach them in the environment where they're going to learn them and use them? It's much easier. That's just my perspective. I know that's how my son learned, and that's how I see so many kids. And my approach is not really about money. That's secondary. As much as I can, I'm there to help and educate parents. I want parents to understand that you are your child's advocate. I want them to understand that whatever they're doing, whether they get outside professional help or not, it's not the end of the world if you don't have therapy for your son or daughter at 2 years old. My son didn't start ABA till he was 7. In grade 3, the board told me, the special ed teacher told me my son would never amount to anything, that he needed to be put in a special school because he couldn't write. Well, my son is now 18 and he still can't write. But guess what? He's learned how to use a computer. He's in grade 12, getting an 88% grade point average in an academic school and looking to go to university to do law. And he just wrote his first book that'll be released on Monday. I mean, so this is a kid that the school system told me would not amount to anything, right? And because he had a mom who fought. So that's what I'm telling you as parents, fight for your kid. I didn't listen to the school. And I fought and I said, no, my son is capable. He happens to be verbal, so his skill is in that. So you know what? I fought with the school. No, you can test him verbally. No, you can let him use a computer to write his test. The teachers will tell you they can't. Yeah, they can. Okay, he does all of his tests on a computer. He has an opportunity to follow up with an instructor to make sure on his essays and stuff that he's doing he's actually answering the question being asked. He has scribes. People have actually sat, spec ed teachers sat and just written what he says. You know what? All of these accommodations are possible, and all they are is accommodations. It's still testing the content in his brain, but it's giving him an opportunity to express it in a way so the teacher can learn what his brain actually absorbed. And that's where I'm saying, that's where you know your kid. Your kid communicates with you. You know how they communicate, right? Whether it's verbally, whether it's non-verbally, you know. So what you need to do is teach other people what that language is.